Flavobacterium branchiophilum is the agent responsible for bacterial gill disease, also known as gill rot. This is a gram-negative filamentous bacteria. The bacteria is an opportunistic pathogen that has a tropism for the lamellar epithelium. Generally, outbreaks occur during periods of stress, following transportation, when there's overcrowding or overfeeding. In short, it's a disease of poor water quality. In regards to epidemiology, transmission is either direct or indirect. Epizootics are associated with significant mortality. Gill rot is primarily a disease of salmonids, and it's limited to the freshwater environment. Young fish are more susceptible. Ancillary testing includes bacterial culture. However, these bacteria are fairly slow to grow. Fortunately, the histopathological lesions are fairly characteristic, so the disease is easily recognized. The image on the top right illustrates how the bacteria are able to adhere to the lamellar epithelium. The image on the bottom illustrates the large numbers of fimbriae that arise from the cell wall. The fimbriae are responsible for its adhesive capabilities. Clinical signs include abnormal behavior, opercular flaring, and lethargy. Examples of abnormal behavior include gasping and swimming near the surface. This is suggestive of respiratory distress. On gross examination, there are large mats of bacteria and mucus covering the gills. The gills are also pale and mottled. Histologically, there's widespread lamellar epithelial hyperplasia, lamellar fusion, lamellar epithelial necrosis, and an accumulation of excess mucus and cellular debris between gill filaments. Within sections of the gill, there is marked multifocal filament bronchitis, highlighted in green, which is associated with lamellar epithelial hyperplasia, lamellar fusion, and telangiectasia of the lamellar capillaries. There's also a marked accumulation of mucus, prognaceous exudates, and cellular debris between gill lamellae. This is highlighted in red. On closer examination, there are frequent thrombi within the lamellar capillaries. These are highlighted in red. As previously mentioned, this lamellar epithelial hyperplasia, highlighted in green, with associated lamellar fusion and degeneration and necrosis of individual lamellar epithelial cells. Closer still, you can see large numbers of filamentous bacteria between gill lamellae, which are closely associated with the lamellar epithelium. These are highlighted in red. Epithelial cells adjacent to the bacteria are undergoing degeneration. These are highlighted in green. Flavobacterium columnare is the agent responsible for columnaris disease, also known as saddleback. This is a gram-negative, thin, rod-shaped bacteria. Flavobacterium columnare is an opportunistic pathogen. It has a tropism for the lamellar epithelium and the epidermis. Outbreaks typically occur with elevated temperature and overcrowding. The virulence can be quite variable and is largely dependent on the availability of certain proteases and adherence factors. In regards to epidemiology, transmission is either direct or indirect. However, some fish can serve as carriers. Outbreaks are often associated with ongoing mortality. This is primarily a disease of salmonids in the freshwater environment. Ancillary testing include bacterial culture. The image on the top right is a classic example of columnaris disease in a fish. Notice the patches of pallor throughout the gills. The image on the bottom illustrates the areas of epidermal pallor around the dorsal fin, giving it the name saddleback. For whatever reason, the bacteria has a tropism for the skin along the dorsal aspect of the body, where it's associated with epidermal hyperplasia. Clinical signs associated with this disease include abnormal behavior and opercular flaring. Examples of abnormal behavior include gasping. On gross examination, there are large pale plaques within the epidermis. Epidermal lesions may progress to areas of ulceration. Within the gills, there's widespread patchy pallor. Histologically, the affected gill is characterized by lamellar epithelial hyperplasia, lamellar fusion, and filament necrosis. Within the skin, there may be epidermal necrosis progressing to ulceration and dermal necrosis. There are extensive areas of necrotizing ulcerative dermatitis and stomatitis on the tips of the mandible and maxilla. These are highlighted in red. On closer examination, there is a large mat of filamentous bacteria on the ulcerated surface, highlighted in red. There's also extensive necrosis and pleocellular inflammation of the underlying tissues. This is highlighted in green. Within sections of the gill, there are multiple foci of filament necrosis, with large numbers of intralesional filamentous bacteria, as outlined by the bold arrows. Flavobacterium psychrophilum is the agent responsible for cold water disease, hence the name. Other diseases associated with this bacterium include rainbow trout fry syndrome. Flavobacterium psychrophilum is a gram-negative, thin rod-shaped bacteria. It's an opportunistic pathogen. The tropism of the bacteria is dependent on the age class. Fry generally develop systemic infections. In the adult, the bacteria have a tropism for the skin and skeletal muscle. However, skin infections can progress to systemic infections, at which point the bacteria can settle in the brain. Outbreaks are typically associated with colder temperatures and overcrowding. In regards to epidemiology, transmission is direct or indirect. However, vertical transmission is also an issue. In fry, epizootics are associated with significant mortality. Epizootics can also occur in adults. In regards to species susceptibility, this is primarily a disease of salmonids in both the freshwater and the marine environment. Ancillary testing includes bacterial culture. The image on the right illustrates the classic lesion of cold water disease, characterized by deep skin ulcers along the dorsal aspect of the body and the caudal peduncle. Clinical signs include abnormal behavior and lethargy. Examples of abnormal behavior include spiral swimming. On gross examination, affected fry typically present with ascites and exophthalmia. In the adult, lesions include skin ulcers with associated muscle necrosis. Healed ulcers can result in spinal deformities via excess fibrosis and contraction of the scar tissue. Histologically, the infection is associated with epidermal hyperplasia, epidermal spongiosis, epidermal necrosis resulting in ulceration, and necrosis of the underlying musculature. The section of the kidney was stained with a silver stain. Large numbers of bacteria are present within vessels of the renal interstitium. These are highlighted in green. There are also large numbers of bacteria within the glomerular capillaries. These are highlighted in red. Within sections of the kidney, there is marked congestion and hemorrhage of the interstitial vasculature with associated hematopoietic necrosis. The lesions are the result of scattered intravascular bacteria, highlighted in green, and intravascular thrombi, highlighted in red, causing bacterial-mediated and ischemic injury. Tenacibaculum marinum is the agent responsible for the diseases known as mouth rot and tail rot. This is a gram-negative, thin rod-shaped bacteria. It's an opportunistic pathogen with a tropism for the oral mucosa, the gingiva, and the epidermis. Outbreaks typically occur when salmonids are transferred from the freshwater to the marine environment, or when hatchery fish are transferred to pens. Skin trauma is also a predisposing factor. The disease is associated with elevated mortality. In regards to epidemiology, Tenacibaculum marinum is a commensal of the skin. Various species of fish are susceptible, but the young are particularly predisposed. Infections occur in the marine environment. Ancillary testing includes bacterial culture. The image to the right illustrates the ulcerative lesions of the skin around the mouth and the oral mucosa. As infected plaques break away from the mouth, they can become wedged in the gills, causing gill disease. Clinical signs associated with mouth rot include lethargy and inappetence, which is unsurprising. On gross examination, there's extensive ulceration of the oral mucosa. Other lesions include skin ulcers and frayed fins. As previously mentioned, if infected plaques break away, they can wedge in the gills and cause gill necrosis. Histologically, lesions include ulcerative stomatitis, ulcerative dermatitis, and necrotizing bronchitis. Within sections of the mandible, there is marked regionally extensive necrotizing and ulcerative stomatitis. The teeth are highlighted in green. On closer examination, the necrotic oral mucosa is covered in a dense mat of filamentous bacteria. Edwardsiella ictaluri is the agent responsible for enteric septicemia. This is a gram-negative rod-shaped bacteria. It's a primary pathogen that causes systemic infections, and it's often associated with elevated temperatures. In regards to epidemiology, transmission is direct or indirect. Epizootics are associated with significant mortality. In regards to species susceptibility, this is a disease of channel catfish and pangasius catfish, and it's limited to freshwater environments. Ancillary testing include bacterial culture. However, this is a very fastidious organism with slow growth. The clinical signs associated with infection include neurologic disease. On gross examination, lesions include ulceration of the skin, ascites, widespread petechial hemorrhage, and pale nodules within various tissues throughout the body. These represent foci of bacterial embolization with associated tissue necrosis. Histologically, this is a multisystemic disease with scattered foci of miliary necrosis and abscessation. Associated lesions include necrosis of the melanomacrophage centers, resulting in pigment dispersion. In the images to the right, you'll notice large numbers of variably sized pale nodules within a variety of tissues. These represent areas of bacterial infection with abscessation or granuloma formation. The image on the top left is a section of the kidney with a large abscess or granuloma containing a dense aggregate of bacteria. This is marked by a white asterisk. The remaining images are scattered foci of hemorrhage, necrosis, and inflammation within various tissues. These lesions are associated with bacterial embolization. Yersinia ruckeri is the agent responsible for the disease known as enteric redmouth, which is an annually notifiable disease. This is a gram-negative rod-shaped bacteria. It's a primary pathogen with a tropism for the intestine, eventually resulting in systemic infection. The disease is associated with elevated stress. In regards to epidemiology, transmission is either direct or indirect. However, certain fish can act as carriers. This is primarily a disease of salmonids in the freshwater and the marine environment. Young fish are particularly predisposed. Ancillary testing includes bacterial culture. The image to the right illustrates some of the lesions that are associated with bacterial septicemia, including reddening of the fin bases, congestion of the kidney and spleen, and generalized hyperemia. The lesions are fairly nonspecific, but are more pronounced in enteric redmouth. Clinical signs include a darkening of the skin, which is evidence of stress. On gross examination, there's marked congestion and hemorrhage throughout the oral mucosa, which is why it's called enteric redmouth. Other lesions in the oral cavity include ulceration. Throughout the rest of the body, you may see widespread petechial hemorrhage. The spleen is often congested. Histologically, this is a multisystemic disease, with miliary necrosis in a variety of tissues. Areas of necrosis are associated with hemorrhage and pleocellular to granulomatous inflammation. Within sections of the liver, there's frequent hepatocellular vacuolar degeneration and necrosis. Examples are marked in red. This is associated with scattered aggregates of small rod-shaped bacteria, highlighted in green. Within sections of the atrium, there are scattered rod-shaped bacteria, highlighted in red. These are associated with thrombosis and hemolysis. There's also scattered degeneration of cardiac myocytes, highlighted in green. This is a consequence of bacterial toxin production. Endothelial cells are frequently hypertrophied. Within the pericardium, there are marked fibrinocellular exudates, highlighted in red. Exudates contain scattered rod-shaped bacteria, highlighted in green. Within sections of the gill, there are frequent bacterial emboli within the lamellar capillaries. These are outlined in green. Affected lamellae are associated with lamellar epithelial necrosis, highlighted in red. Vibrio anguillarum is the agent responsible for vibriosis. This is a gram-negative, rod-shaped bacteria. It's an opportunistic pathogen which causes systemic infections. Outbreaks are associated with stress and elevated temperature. In regards to epidemiology, this is a commensal organism of the gastrointestinal tract. However, invertebrates within the environment can serve as reservoirs. Epizootics are associated with high mortality. Various species within the marine and brackish water environments are susceptible to infection. However, the young are particularly predisposed. Ancillary testing includes bacterial culture. Clinical signs include inappetence and darkened skin. On gross examination, there can be extensive regions of myonecrosis, progressing to ulceration. This is the result of bacterial embolization to the skeletal muscle. Infection is also associated with lesions that are typical of septicemia, including ascites, widespread petechial hemorrhage, and splenomegaly. Other lesions include keratitis, ulceration, and divulsion of the contents of the eye. Histologically, this is a multisystemic disease with widespread necrosis and hemorrhage within the affected tissues. Examples include necrotizing myocarditis, necrotizing myositis, progressing to cellulitis and dermatitis, widespread hematopoietic and lymphoid necrosis, and hemolytic anemia as a consequence of bacterial toxemia. The image to the bottom right is an example of an extensive area of muscle necrosis which progressed to dermatitis and ulceration. The image above is an example of widespread edema and petechial hemorrhage associated with septicemia. Within sections of the kidney and intestine, there are scattered bacterial emboli with associated tissue necrosis. These are highlighted in red. Within sections of the atrium, there are large numbers of rod-shaped bacteria within the epicardium with associated inflammation. These are highlighted in green. Aeromonas salmonicida is the agent responsible for furunculosis, which is an annually notifiable disease. This is a gram-negative, short, rod-shaped bacteria. It's a primary pathogen and responsible for systemic infections. Outbreaks are typically associated with crowding, elevated temperature, and low dissolved oxygen. In regards to epidemiology, transmission is either direct or indirect. Some fish can serve as carriers. Epizootics are associated with significant mortality. Although this is primarily a disease of salmonids, other species can be affected. Infections typically occur in freshwater environments, and less so in marine environments. Ancillary testing includes bacterial culture. The image in the top right is an example of a furuncle, which is a focus of bacterial embolization in the underlying skeletal muscle, causing tissue necrosis and inflammation. The furuncle will eventually rupture, causing ulceration, while releasing millions of bacteria into the surrounding environment, which will go on to infect other fish. Clinical signs associated with infection include inappetence and darkened skin. On gross examination, there's widespread petechial hemorrhage. In chronic infections, furuncles will develop. These will eventually ulcerate and release bacteria into the environment. Histologically, bacterial aggregates are associated with very little inflammation. This is a multisystemic disease, so you'll often find areas of necrosis within a variety of tissues. Aeromonas salmonicida can also be associated with toxic cardiac necrosis. This is a condition where bacterial toxemia can cause myocardial degeneration and necrosis. Other lesions include necrotizing cellulitis and dermatitis. The bacteria can also cause degeneration and necrosis of melanomacrophage centers, resulting in pigment dispersion. The images to the right are just examples of petechial hemorrhage within the skin and swim bladder as a result of septicemia. Within sections of the heart, there are dense aggregates of bacteria, highlighted in green. Inflammation is rare. In some areas, bacterial aggregates are associated with liquefactive necrosis and hemorrhage. This is highlighted in red. Here's a close-up image of a large aggregate of rod-shaped bacteria within a section of the heart. You'll notice the degenerate cardiac myocytes along the edge of the bacterial aggregate. These are labeled in red. Within sections of the liver, there are scattered aggregates of rod-shaped bacteria within hepatic sinusoids. These are labeled in red. They're often associated with hydropic degeneration and necrosis of the surrounding hepatocytes. Piscirickettsia salmonis is the agent responsible for piscirickettsiosis, also known as salmon rickettsial septicemia. This is a gram-negative coccoid bacteria. It's an obligate intracellular parasite with a tropism for macrophages and endothelial cells. Outbreaks are typically associated with elevated temperatures. In regards to epidemiology, transmission is either direct or indirect. However, vertical transmission is also an issue. Some fish serve as carriers. Epizootics can result in significant mortality. Piscirickettsiosis is a disease of salmonids in both the freshwater and the marine environment. Ancillary testing is available, including real-time PCR, immunohistochemistry, and tissue culture. The image on the right illustrates how the rickettsial organisms are able to adhere to the eggs. This is how vertical transmission takes place. The clinical signs associated with piscirickettsiosis include lethargy and darkened skin. On gross examination, you may find nodules and ulcers throughout the skin. There's also pale mottling of the liver and widespread petechial hemorrhage. The kidney and the spleen are also enlarged. Histologically, there's widespread vasculitis and perivasculitis, which is characteristic of the disease. Endothelial cells are often hypertrophied with intracytoplasmic protein droplets. Damaged vessels are often associated with intravascular thrombi. Piscirickettsiosis is a multisystemic disease, so it's typically associated with scattered foci of necrosis and lymphohistiocytic inflammation affecting various tissues. For whatever reason, the bacteria have a tropism for the meninges of the brain, causing lymphohistiocytic meningitis. In some cases, the rest of the body may be devoid of lesions. For this reason, it's always important to sample the brain. The image on the top right is an example of the skin lesions you may find with piscirickettsiosis. The image on the bottom illustrates the characteristic mottling of the liver. Within sections of the liver, there is an extensive area of necrosis with associated thrombosis and pleocellular inflammation. This region is highlighted in red. Within the area highlighted in green, there's overlying zonal hepatic necrosis associated with tissue hypoxia. On closer examination, many of the degenerate hepatocytes and macrophages contain large numbers of intracytoplasmic basophilic structures consistent with rickettsial organisms. These are labeled in red. Vessels throughout the liver are cuffed by pleocellular inflammatory infiltrates. There is fibrinoid degeneration of the affected vessel, consistent with vasculitis. The damaged vessel wall is highlighted in red. Within sections of the kidney, there are patches of hematopoietic necrosis with scattered intrahistiocytic rickettsial organisms. These are highlighted in red. Renal tubular epithelial cells and endothelial cells contain brightly eosinophilic granules within their cytoplasm. This is highlighted in green. These granules are evidence of stress and systemic immune stimulation. Within sections of the spongy ventricle, there are scattered foci of endocarditis, with large numbers of rickettsial organisms within macrophages and reactive endothelial cells. These are highlighted in red. Some of the infected cells are undergoing degeneration. Renibacterium salmoninarum is the agent responsible for bacterial kidney disease. This is an annually notifiable disease. The bacteria are gram-positive and rod-shaped. It's an obligate intracellular parasite causing systemic infections. Outbreaks are associated with temperature changes. In regards to epidemiology, transmission is either direct or indirect. Vertical transmission is also an issue. The disease is characterized by chronic infections with low levels of mortality. It's primarily a disease of salmonids in the marine environment. Ancillary testing includes real-time PCR and fluorescent antibody test. The image on the bottom right is an example of ascites resulting from renal failure. Clinical signs associated with BKD include abnormal behavior and darkened skin. Examples of abnormal behavior include disequilibrium. On gross examination, affected fish have ascites and widespread petechial hemorrhage. The kidney and spleen may be enlarged, and you'll often find scattered pale nodules within a variety of tissues. Histologically, this is a multisystemic disease associated with necrosis and granulomatous inflammation. Despite the name, lesions will often occur in the central nervous system in the absence of kidney disease. The image to the right is an example of granulomatous nephritis. Within sections of the brain, there's marked expansion of the meninges via lymphohistiocytic inflammation. This is highlighted in red. There's also evidence of inflammation extending into the underlying brain parenchyma. This is highlighted in green. In other areas of the brain, there's an extensive area of encephalomalacia, highlighted in red, and granulomatous inflammation surrounding vessels throughout the brain parenchyma, highlighted in green. On closer examination, areas of granulomatous inflammation contain scattered multinucleated giant cells, labeled in red. Macrophages frequently contain a fine dusting of purple within their cytoplasm. This is highlighted in red. These are actually dense aggregates of tiny rod-shaped bacteria, consistent with Renibacterium salmoninarum. After applying the Gram stain, the Gram-positive bacteria are highlighted in dark purple. Moritella viscosa is the agent responsible for winter ulcer. This is a Gram-negative, curved, rod-shaped bacteria. It's an opportunistic pathogen with a tropism for the epidermis. Epidermal infections can progress to systemic infections, however, this is uncommon. The disease is associated with overcrowding and excessive handling. In regards to epidemiology, this is a commensal organism on the skin. Chronic infections are associated with significant mortality. Winter ulcer is a disease of salmonids in the marine environment. Ancillary testing includes bacterial culture. The images on the right are examples of skin ulcers characteristic of this disease. Clinical signs associated with winter ulcer include lethargy. On gross examination, you'll find skin ulcers. In cases of septicemia, there'll be widespread petechial hemorrhage. Histologically, lesions include ulcerative dermatitis with associated hemorrhage. Septicemia is characterized by a multisystemic disease, so you'll see scattered foci of necrosis and associated inflammation within a variety of tissues. This is a close-up of the previous section. Spanning the entire field of view along the top of the image, there's an extensive area of cutaneous ulceration. The affected area is characterized by a loss of the epidermis and in some cases a loss of the dermis, resulting in an area of exposed hypodermis. This is highlighted in red. There's also extensive degeneration of the underlying skeletal muscle. This is highlighted in green. Degeneration of the muscle is likely the result of bacterial toxin production, as well as exposure to a hyperosmotic environment. On closer examination, there are large numbers of rod-shaped bacteria within the necrotic dermis.